close the mouth, close the eyes. Then we look at our cheek stuff. The deepest one is the buccal, that's our fish face underneath. And then we have the temporalis, which is up here on the temple as well as down here. And then on this side we have the masseter muscle. There. So they go in that order, that 3-layer order. This side is most superficial. Let me put the chest on here. Any breaks? Okay, so this side is most superficial. Like if we take the skin off, that's the layer we come to. Then this side, we cut off a layer and we're a layer deep here. So when we're talking about the muscles, we have muscles bilaterally, but sometimes we see a different muscle on this side than that side because we're doing a cross section. So when we look at those 3 muscles, the temporalis is the most superficial right here. 1 layer deep is the masseter muscle, and both of those are helping elevate the jaw. That's our chewing muscle. So it's temporalis, underneath that masseter, underneath that buccal. Then the buccal is that cheek muscle underneath the masseter, is in the little triangle right there. That's our buccal muscle. So those are like the 3 face muscles that stack up on top of each other.
Is that the buccinator? Is the same thing?
Buccinator, yeah. Buccinator, buccal, bucca.
It's the same thing.
All means cheek. Yes,
Okay.
same thing. Then we have the 4 muscles that have something to do with our mouth, or we have smile or frown. And those are going to be on the corners. The zygomatics, that's the V-shaped one there, the zygomatic smile. And then the frowny muscles, depressor, down, angularis on the corners of the mouth. Depressor, angularis, oris. So we have smiling muscles and we have frowning muscles. Those are antagonistic face muscles. And then we go more medially and we're going to snarl or we're going to pout. And again, which way are we going? Levator, labii, lips, labii, superioris. We're elevating the lips in a superior fashion. Those are going up the nose, that's the snarl. Or we're pulling down, depressor, inferioris, labii, pulling down, pouting. So medial are snarling and pouting, more laterally are smiling and frowning. Those are antagonistic muscles. Everybody got that?
What was right here again? Where it was?
It's frowning,
Okay.
depressor, down,
Okay.
angularis,
Okay.
oris, pulling down the corners of the mouth. Okay. So just look at the words, and that helps you identify what it is. Okay. Of the neck, we have the SCM, the sterno attached to the sternum, the cleido attached to the clavicle, and it goes on the mastoid. Because it crosses over, we're going to have some level of rotation, and if we shorten it, we flex. So the SCM is the neck flexor and rotator, and its antagonistic muscle is the trapezius for extension. And also, if we take the traps off 1 layer deep, the splenus capitis for extension. So, extensors, if we shorten it, it's going to pull the head back. If we shorten it, it's going to flex the neck forward. While we're on the back, we have our latissimus dorsi, our great big muscle, swimmer's muscle. That's extension and medial rotation. We're coming around, extension, abduction, and medial rotation. The swimmer's muscle. Gluteus maximus is back here. So which way is it going to go? Back. So think about it. If it's there, where's it going to go? So that's extension. The gluteus medius are on the sides. They're on the sides. So which way are they going to go? Abduction to the sides. So look at it and think about, does it make sense that this muscle would abduct? That doesn't make sense, right? it's on the side, so it makes sense that it would be an abductor. And then if we turn it around, it's on the insides, the medial side, so that makes sense it'd be an adductor. Think about where are they located, and then that helps you also. If we look at our leg, so that's the only thing they can ask here is adductors. Medial side are going to be your adductors. Medial, we look down, there's our big toe, so we know we're on the medial side. And the only adductor we have to label is the gracilis. That is an adductor, it goes up and down. We have our quadriceps, and remember we have 4 bellies because it's called a quad. Where does it go? Up and down, rectus, the femur, femoris. Or we're going to be on the sides, the inside, vastus medialis, or on the outside, vastus lateralis. If we take that off, and we're going to be in between, that's the vastus intermedius. In between. Those are the 4 bellies of the quads. And what do? They flex the thigh. So flexion of the thigh is this action. But remember, it comes across and inserts on the tibial tuberosity, so it's going to have an action on the leg, and that action is put your leg back down, extend it. So, thigh flexors, hamstrings are thigh extensors. Same thing, it comes across the knee, so it's going to have an action on the leg. If these are extending the thigh, they're going to flex the leg. So just remember, whatever goes on up on top is the opposite on the bottom. Flex the thigh, extend the leg. Extend the thigh, flex the leg. We're going to do the opposite. And the bellies of our hamstrings. Which side are we on? If we're on the lateral little toe side, biceps femoris. If we're medially, semimembranosus, the M's go together, membranosus medial, and tucked in the middle, semitendinosus. Flexors, extensors, extensor. The gluteus maximus and the hamstring are both extensors. Because they're on the back, they're not going to go forward, they're going to go backwards. Then we go down to the bottom of the leg, gastrocnemius or calf muscle. That's going to help us go up on our toes. We call that plantar flexion. And what's going to help that is the soleus muscle on the side. The soleus and the gastrocs are both plantar flexors. The gastroc also is this great big one down the back of the leg, so it is a leg flexor. And it attaches the muscle to a bone. What do we call things that attach muscles to bones? Tendons. What bone are we attaching to? The calcaneus, the heel. So that makes this the calcaneal tendon. We're attaching the gastroc to the calcaneus, and it's that tendon that's going to hold it down. That's our calcaneal tendon. Soleus on the side. Then we go to the front. On the front of the tibia, so remarkably, we call that the anterior tibialis. Just like that. And its action, if we shorten it, if we tighten it up, it's going to bring the toes to the shin. That's dorsiflexion. Dorsiflexion is the opposite of plantar flexion. Anterior tibialis. If they tag that, what is it? Anterior tibialis. What is its action? Dorsiflexion. What is its antagonistic muscle? A, B, C, D, or E? If it dorsiflexes, which muscles plantar flex? These two, gastrocs and the soleus. So that could be a two-parter if they have both of those listed. If they don't, it's going to be one of those two. But that's just a way of how they ask antagonism. Oh, I lost my gluteus maximus. I know, wouldn't that be nice? If we put an X on it and tag it, what is this muscle? The quads. What is the antagonistic muscle?
The hamstrings.
Hamstrings. So we could go A, B, C, D or E, you would pick E as the antagonist. All right. Questions over the leg? And then the arm, that's easy. There's only 3 things we have to know about that. We have the cap of the sleeve. What do we call that?
The delta.
The delta, because it's in the shape of delta.
Delta.
That's why we call it the deltoid. It has 3 bellies though. It flexes, it extends, and it abducts because it's on the side. Just like the gluteus medius, it takes away, it takes away. Biceps flex, triceps extend. And then they could label it here on this model, the delta. Deltoid is the cap of the sleeve. And then biceps in the front, triceps in the back. So again, remember to pay attention to the direction. It's easy to get that one wrong if you turn it over and you're like, yep, biceps on the front, triceps on the back, and you're standing here looking at it like this. It's in the prone position versus the supine position. So pay attention to where is it. Biceps is on the thumb side, triceps is on the pinky side. If you get confused on the test, get yourself in anatomical position. Be like, oh yeah, there's my thumb, there's my bicep, or there's my pinky, there's my tricep. So supine position, prone position. It's not really changing on our body, but it's easy to get turned around if this is lying all by itself on the table. Pay attention to that. Same thing when you're answering vastus medialis and lateralis, or biceps femoris semimembranosus. Is the leg facing up or is the leg facing down? Pay attention to where your toes are. Medial, big toe, lateral, little toe. So that's where people mess up on arms and legs. Arms and legs are super easy, but if you take it out and set it on the table, then sometimes you get a little turned around. So pay attention to that.
If they set it on the table in a prone position like this,
Yep.
the question will not be for something underneath.
No.
Okay.
So it'll tag it, and you come up, and a lot of times you're like, yep, that's the front of the arm, that's the bicep. It's face down, that's the tricep.
Okay.
Yeah. No, you'll be able to see it though, or it'll be face up like that. Biceps, triceps.
Gotcha. Thank you.
Yep. All right, that's arms and legs, face, back. Then we have the chest. Most superficial, pec major. We take 1 layer off, pec minor. Underneath that, serratus anterior. And then inferior to that is the intercostals. And on expiration, the external intercostals open up. That'd be these guys out here. And on inspiration, we close down internal intercostals. That's on the inside. Those are these guys. Outside, external intercostals. External intercostals outside, internal intercostals inside. And then the abdominal muscles, outside on an angle, external, outside, oblique on an angle. We take 1 layer off. We have up and down the abdomen, rectus femoris, and internally, internal obliques. And then the deepest layer, transverse abdominis. All of those being trunk flexors. And then the last one, inside the torso model, the iliopsoas. Ilio touching the iliac part, psoas in the middle part of it. That's our iliopsoas, which flexes the trunk, but flexes the leg as well. Flexes. So instead of just being this, abdominals, it's this. Flexors here and flexors here. And that is it. Those are all your muscles.
Where's that one?
Okay.